Joining us. Welcome. Thank you so much for being here. Please feel free to share where you are tuning in from today if you'd like to in the chat and maybe what you hope to learn. We welcome your questions for our panelists. Welcome to Practical Strategies for Supporting Mom Through Postpartum Depression. My name is Lisa Meekum. I'm a volunteer with Families for Depression Awareness, and I'll be moderating today's conversation. I'm a person with lived experience of depression, and I've been a caregiver for others experiencing depression and bipolar disorder. We're so glad you're here with us, either live this evening or for those of you watching the replay of the video later. For our program together, in a minute, I will introduce our expert panelists. We're thrilled to have an experienced social worker and doula to discuss practical ways of supporting moms through postpartum depression. Throughout this talk, you may hear us shorten postpartum depression to PPD. Again, we encourage you to share your questions or comments in the chat throughout our discussion. We'll try to weave them in when we can. This program is being recorded and you'll be able to watch it immediately after it airs. And we'd like to remind you that we're doing a survey to evaluate our program. So if you can stick around after our presentation to fill out our survey so we can improve programs in the future, we would greatly appreciate it. I would love to tell you a little bit about Families for Depression Awareness. Our mission is to help people recognize and cope with depression and bipolar disorder, to get people well and prevent suicides. Our philosophy is that when a person is living with depression or bipolar disorder, it's the people around them, it's the parents, the siblings, the grandparents, the friends, all of those people in their lives that have a strong and powerful position to support that loved one. Yet caregivers don't always know what to do. And that's where Families for Depression Awareness comes in. We provide education, training, and support specifically geared towards family caregivers so that they can be a strong advocate for their loved ones. They can be a partner in care, and most importantly, so that we can support family units because that's what we really believe helps improve health outcomes. The hub of our resources is our website, familyaware.org, which some of you may have already visited, but if you've not yet had the chance, please go to our website and you will see other webinars and workshops that we have had in the past and ones that are coming up in the future. The QR code here on the slide goes to our newsletter where you can sign up for that. We encourage you to use our web tools such as our depression and bipolar screening test and our caregiver stress test. We also have a mental health family tree tool on our website, and you can find loads of other resources, including family stories and expert interviews. So we encourage you to visit familyaware.org for more information and resources for family caregivers. Before we launch into our program, we want to thank our funders that made our programming possible. Special thanks to Sage Therapeutics and Biogen for supporting this program. And of course, people just like you who donate to us. You believe in our mission, you believe in our cause, and if you are one of those people who have given us a financial contribution so that we can provide programming free on issues of depression and bipolar disorder and how they affect families, we thank you and we greatly appreciate you. I would like to introduce our experts for our discussion this evening. Annie DiTiberio is a licensed clinical social worker in private practice in Los Altos, California. After receiving her MSW in community mental health from UC Berkeley, she has worked in almost every level of care, both public and private, in Santa Clara County. She now focuses on helping families navigate the mental health system, as well as their own relationships with their loved ones, striving to include families in the important treatment of those with significant mental health issues. Annie also experienced infertility and went through her own journey of family planning using assisted reproductive technology. This led her to specialize in helping families navigate infertility and ART specifically, IVF, donor egg sperm, gestational carriers. She is a member of the American Society for Reproductive Medicine Mental Health Group. And Jeanette Myrick. Jeanette is a Massachusetts-based community doula and data specialist with a company, Doula Care, where she creates and manages systems to organize and analyze doula service and perinatal outcome data. Through her work as a doula, Jeanette brings firsthand experience and a deep understanding of the challenges faced by perinatal people, which enriches her ability to use data to improve service delivery and advocate for the value of community-based care. In addition to her role at a company, Doula Care, Jeanette manages implementation science studies focused on perinatal mental health, doula care, and health equity. One such study aims to expand access to mental health support for perinatal people by integrating doulas into mental health care. Jeanette holds an MPH from Boston University School of Public Health. So, welcome to you two. Um, I am the mother of two children. I did not ever become diagnosed with PPD, but I certainly experienced tremendous overwhelm and emotions when I had my children and felt, a little bit of shame about that and confusion. I didn't know I could ask for help. I thought if I did, maybe I was doing it wrong. So I really greatly appreciate this topic and look forward to our Q&A together. So we'll start out with Annie, you can take this first question. What are the most common warning signs of postpartum depression that families and caregivers of new mothers should watch out for?
Great. First of all, happy to be here and hope this is helpful to many family members who are watching. It's a tricky question. The most common warning signs, right? What I want to say is I'll go over some of the common warning signs, but I really want for families to recognize that postpartum depression doesn't necessarily look the same in any two people. And so I've heard from clients where they're like, well, I took the screening test and it didn't meet criteria, but they were really, really struggling. So just if anything feels really off with your loved one, that's probably an indicator that some kind of care should be sought. So let me just say that. But I think, you mentioned, Lisa, the feelings of overwhelm. I think that is a really common one, but it goes beyond kind of just overwhelm. It's almost like a lot of times people will say, I was questioning like whether I even should be a mother. Like, do I even have this in me? I can't do this and I'm never going to be able to. So, not just, oh, I'm feeling overwhelmed, but these bigger questions of their capacity to do the role. I think also, severe sleep disturbance where, they always say sleep when the baby sleeps, but they can't sleep when the baby's sleeping. They can't nap, even though they're tired. The baby's sleeping after feeding at night, but they aren't, right? Those are indicators that something is off. I think, a common one, but again, one that not everyone experiences is not feeling bonded to the baby or feeling like this feels really different than I thought, feeling disconnected, kind of then judging themselves around like I shouldn't feel the way I'm feeling towards the baby. And then another one that I think is really common is like really significant guilt sometimes around their motherhood experience. So feeling like their baby can tell that they aren't bonding or that their baby deserves better because they're not figuring it out, right? So really some things that kind of go beyond just like, crying or feeling sad or it's really much more extreme. And then I want to say a little bit about the fact that postpartum depression can also sometimes look like anxiety. And I'm not talking about postpartum anxiety, which is its own thing, right? Where you're feeling really revved up, but where again, this sense of I need a sense of needing to control or else things aren't going to be okay. Sometimes they'll be seeking a lot of reassurance. Am I doing this right? Is this okay? Is the baby okay? Right? So a lot of sometimes it doesn't manifest as sadness. It can be more of an anxious feeling or a lot of worry. And sometimes I think that catches people off guard and they'll say, well, I'm not sad. So therefore I don't have this.
That makes a lot of sense. That's a very important distinction too. Jeanette, how about you? What are some of the common signs that you've seen?
I wholeheartedly agree with what Annie already brought up, and I completely agree as well that it can really look different in different people. Two signs that I want to add to Annie's list, pretty exhaustive list, is withdrawn behavior. So if the mom or the birthing person is pulling away from maybe her baby, her partner, her support system, you as the caregiver, this could be a red flag. And it's normal, of course, to need space, especially when going through something as impactful and amazing as birth. But if it's prolonged and it becomes consistent, this can be a sign that something deeper is going on. And then another thing on the flip side of Annie's about not being able to sleep, exhaustion is similar in the sense that feeling tired is a given, but if it's consistent fatigue and it doesn't improve when they're able to get rest, that can be a sign as well. So those are the two that I would add.
That's great. And we have a comment here, sleep when the baby sleeps is such a myth. There's too much to do. And that kind of gets to the second part of this question, which is, how can we communicate to our loved ones if we see that some of these signs are emerging in them? Obviously, there are all these sort of myths and things that we throw at new moms, but how can we realistically talk to them about if we're seeing some of these signs of PPD? Either one of you can take it, or both. Annie,
Yeah,
you want to start?
I'll jump in with this. I really believe that the OB appointment should not wait till 6 weeks. And so I would say from even before, birth happens, having a plan of like, hey, let's make sure we get in there, sooner, just so that we can check in and make sure everything's going okay. So I would set the precedent that like, hey, we should be checking in with your OB, like, to make sure everything's going okay with the baby and with you. That's really important to be proactive. And then, if it's later on that this is developing, I think just kind of saying, I want us to be, transitioning as well as we possibly can. I want you and me and the baby to all have as much support as we can, because we don't necessarily go through this very often, right? Like you might have a couple of times when I had twins. I only went through it one time, right? So, really setting ahead of time saying, I want us to make sure that we're being really proactive about all of our well-being. And I understand that you think everything's fine. I need to go check in with a doctor to make sure that we're doing all right, and it would make me feel better. I sometimes say you can use your relationship to get someone to seek out care. Hey, I hear that you're not worried. I'm worried. It would make me feel better if we can just go and I can ask some questions. You don't even have to talk if you don't want to, right? So that it's really a concerted effort as a family to go and talk about these things and see what the OB or GP or whoever you're going to suggests.
Yeah,
Yeah.
I agree, of course. And Annie was doing this automatically, but one thing I really lean on is using I statements when asking how people are doing. So I say like, I've noticed you've seemed overwhelmed, or I've seen you struggling more lately. And that's exactly what Annie was doing. So definitely leaning into it being you having the concern and not making it sound like an accusation, more open and wanting to have an honest conversation about what's going on. Another thing I love to do is ask open-ended questions. This is what I encourage my caregivers and families to do. So something you could ask is, can you tell me more about what's been happening, or how are you really doing right now? And it just allows them to start to put into words what they've been feeling, which is often the most challenging part. And I think as a doula, my job is really to encourage my clients and families to reach out to their therapists and other mental health professionals. And sometimes that means helping them identify things that they may have not realized they were struggling with. And it's not all easy to ask for help, just as you were talking about earlier, Lisa. But when we do it in a way with the I statements, expressing care and asking open-ended questions and being non-judgmental, it can really open a door for healing.
Yeah, I want to say one other thing Jeanette just mentioned about reaching out to therapists. So, postpartum depression generally hits maybe about 13% of the population. But if you have had a previous history of depression, that rate doubles. It's like 25 to 40% of a risk of postpartum depression. So, if somebody has a history of depression, I always recommend either find a therapist while you're pregnant, or if you've already had a therapist, reach out to them and automatically set something up within the first couple of weeks, if not month of delivering, just as a like, let's just plan, right? Let's just have
Mhm.
that booked. And listen, if everything's going great, fantastic, and you can schedule something, in another month, or just say, hey, reach out to me, or have the loved one reach out to them. But I think it can be really helpful if there is a history to have that kind of care already established just in case.
That's so important and actually reflects a comment here. Um, I have a history of depression, so my support team knew to look out for possible signs of PPD after my daughter arrived. It felt supportive to have a plan in place ahead of time. I mean, it's been so long since I had kids, but after you said, Annie, 6 weeks since you have the kid that you go see the OB, I'm like, that's a lot of time. So that's great to have something else in place if need be. Thank you so much. All right, let's move on here. Jeanette, you can start out with this one. How can families recognize when professional help is needed, and what steps should they take to get it? And then what kind of support is available? So if I'm a caregiver, I'm recognizing something's needed. Maybe I don't already have a plan in place. What are some resources and ways I can go about that?
Of course. So I've definitely seen how hard it can be to know what's a common experience and what might be a sign to get some more help. So one thing I always say is trust your gut and don't wait until it starts to feel like a crisis. So if someone is feeling down, anxious, hopeless, and just not like themselves for more than maybe a couple of weeks, or if it's getting in the way of daily things like eating, sleeping, or caring for the baby, it's completely okay to reach out, and that's actually the strong and loving thing to do. And as we keep saying, like doesn't have to be on mom, it can be in the caregivers to keep an eye out too. So if you see them maybe missing feedings or skipping appointments, important appointments, or showing signs of not being safe with themselves or the baby, it's time to bring in some more support. As we've been talking about, I really think that early connection can make a huge difference. And that can be with your OB or midwife. The baby's pediatrician can also be a resource, as well as a mental health provider. There are also helpful resources like Postpartum Support International, which has like a warm line and support groups in a provider directory that can get you connected to a professional or some groups that you may want to explore. And there's also the National Maternal Mental Health Hotline, which is 24/7 and confidential. So I typically offer those to my clients, those resources.
Oh, that's wonderful. Thank you. And we're putting those in the chat so that those resources will be in the chat as well. And how about you, Annie?
Yeah, I mean, I'm a really big fan of people considering medication sooner rather than later. We actually know that maternal depression can negatively affect a baby's development. Like, it is very well documented. And actually, the risk is greater for maternal depression than any of the medications that might be prescribed. Now, obviously, I'm not a psychiatrist, so I can't tell you what to do or what medications to take, but it often is a really good idea to get on medications. And I think sometimes people will think, well, I'll try therapy first. Sure, absolutely, you can. But I think it can be helpful for moms to know that like the depression is actually like not great for the baby, because sometimes that can help them overcome kind of some of the, oh, but the medications, which a lot of them actually are okay. You can continue breastfeeding with a lot of them. The one thing I would say is that when looking for a therapist or a psychiatrist, it's really great to find one who specializes in like the postpartum period. Psychiatrists in general, there are some special women's health psychiatrists who will know which medications are safe, which ones aren't. And so they'll be able to prescribe with confidence, versus some psychiatrists might not have as much of that knowledge. So it's good to find a specialist. I also want to say that depending on your location, there are postpartum specific partial hospitalization programs, which is day treatment programs where you go oftentimes with your baby to meet with other moms who are going through postpartum mood issues. You're in groups, you meet with a psychiatrist, you meet with a therapist, you're there 3 to 5 days a week. It can be incredibly, like, I had a client who called it life-changing. So those resources are often available depending on where you live. And then I will also say there are two, that to my knowledge, two specific psychiatric inpatient units dedicated to postpartum depression. One is in Los Altos, California, so right down the road from me. The other one, I believe, is at UNC in North Carolina. So that if someone really is struggling, even with a partial hospitalization program, they're not able to be safe, there are actually specific dedicated units that can help with that. So just to be aware that, like, there really is a full spectrum of support available, because we want our moms to be healthy and good, and they deserve to get back to feeling well as quickly as possible.
Oh, that's wonderful. I don't know if it still exists, but I know in the state of Missouri, when I had my babies, they would have parents as teachers. They'd have people come into your home and you'd be able to interact with them as a resource. So maybe states also have individual resources available to people too, especially if you've got working parents and you've just got a lot going on. Just to have someone come in and help you feel less alone can be really helpful too. Okay, so Annie, let's give you this question to start with. What resources and support services are available for mothers with postpartum depression, and how can families access them? We sort of talked about that, but anything else you want to say? And then how can caregivers help mothers build confidence to reach out for help? I think as a caregiver, this is often very much a challenge, especially with how much shame and sort of cultural stigma there is around being a good mother.
Yeah, I mean, I do think I think we mentioned a couple of ones earlier just in talking about what supports are available. So Postpartum Support International is like, I mean, it's an international hub, right? And what they have there, not only do they have directories of specially trained therapists and psychiatrists that you can find who will know this area. They also offer a lot of postpartum support groups that are free. They have online forums where you can type in what's going on and what your questions are and what you're experiencing. They even have peer mentors that they can pair mothers with. So a mother who has gone through it herself and has said, I'd like to help somebody else going through it. So there's that resource alone. Really, if you only have the bandwidth to Google one thing, like they cover so much. And I will say that, like, around the, talking with them about accessing help, sometimes I will suggest, like, have them go on an online forum first. You don't even have to post. You can just read what everybody else was talking about and be like, oh, that sounds like me, or no, that's different. I mean, sometimes I'll say, go online and see what other people are talking about and see how much of it resonates with you. Guess what? We never judge somebody else for feeling depressed, right? It's only ourselves. So if they hear other really honest, respectable, wonderful people who are also struggling, and then they're seeing people tell them to get help, right? Sometimes it can soften that blow a little bit and be like, oh gosh, I want her to get help. Maybe that's what my family is saying. Or maybe, have them post anonymously, here's what's happening with me, and see what people say. I think that kind of it's like their peers, right? Giving them feedback. And I think that can be a really powerful way to kind of decrease some of the shame around it.
I think another resource I would add would be your community health centers or mental health clinics. And they can be very helpful because they may offer something like sliding scale therapy, other support groups for folks in your area, and sometimes even culturally or linguistic responsive providers to have someone that may match your culture and language, which is really helpful. Also, maybe biased here, but I do want to put doulas themselves can be a resource, especially for families that may be navigating PPD. So we're often checking in frequently, as well as helping with feeding, recovery, and just the daily rhythms of life that come with a new baby. So this puts us in a unique position to really notice emotional changes early, validate what a mom may be feeling, and help normalize reaching out for support. So there are doulas that are specifically trained in postpartum care and can offer emotional support and help with baby related tasks, as well as provide some referrals or warm handoffs to trusted maternal health professionals. But I will say doulas are not therapists at all, but we like to say that we're part of a family's emotional safety net. And so we're there for the family and the caregivers and the mom for support that they may need.
Jeanette, how do people find a doula?
Okay, so it depends. So, so sometimes doulas are connected through hospitals. So through your OB, you may be able to find a doula, as well as there are community organizations that you can reach out to that can pair you with a doula. Also, your insurance may be able to get a doula, like find a doula for you. And there's doulas also have their own private businesses. So you could also search doulas in your area. We have certain bodies of doulas that like bodies or organizations online as well that you can search specifically for people in your area. So Google's always good, but I always recommend to see if your insurance does cover it because it's starting to become more of a thing, which is awesome.
Yeah, that's so great. That's so good. We have a comment here from Cynthia in sort of this vein of noticing and some symptoms people might be having. And she said, "I am here because my hairstylist has postpartum. It is difficult. She is late for appointments, looks unkempt. Thank goodness she's finally getting help. Important topics." Thank you, Cynthia, for your care for your friend and hairstylist and for being here. I think all of us know moms, and all of us have the ability to interact with women in different points of our life, and it's helpful to have resources to be able to do so. Let's see here. Okay, Jeanette, moving on to having you tackle this question. How can partners and family members best support a mother experiencing PPD? Can you share some practical strategies for creating a supportive environment at home during recovery from PPD?
Yeah. So, in my experience, one of the most powerful things caregivers can do is really shift from trying to be the fixer or fixing it to simply being present. Because, in my opinion, PPD doesn't necessarily need a fixer. It needs a witness, it needs a team, it needs like a place to land. So, I've seen families make a huge difference, not because they had all the answers, but because they just kept showing up with compassion and being there for the mom. And that might look like checking in every day with the question that isn't like, how's the baby? Or, how's little one doing? But how are you really feeling today? And then pausing and listening without judgment, without trying to jump to advice, but just holding space. And I feel like that alone can be healing for moms. I think another big thing is to protect the mom's rest, because we talked about it earlier, fatigue, sleep deprivation, and postpartum mental health, those are very tightly connected. So if there are other children in the house or if the baby isn't sleeping well, that mental load can really compound and become quite brutal. So that maybe means that you're taking overnight time feeding if you can, or that may mean you're running interference when there's visitors trying to come over and see mom, but mom needs to take a nap uninterrupted. Or that it could also be like you holding baby while she showers, eats a full meal, washes her hair. Basic care can really go a long way. I think another thing is also having some sort of structure as well. So I often talk to families about creating sort of like a calm rhythm in the home. So I'm not saying like strict schedules, because babies don't stick to schedules. We know that. But maybe having like a gentle routine or like a weekly check-in or a daily check-in at a certain time. So you may have a short morning walk together, a 10-minute break every afternoon where mom gets a little bit of quiet time, something like that. Yeah. And then one more thing will probably be reassurance. So always saying like, you're not alone. I'm here. I see you. Those phrases and like really meaning it can really chip away at some of the isolation that comes with PPD.
Yeah, I feel better just hearing you say all those things. Annie, how about you?
Yeah, Jeanette, you had some really good ones. I was like scribbling some of this down. I was like, the language, this is great. Yeah, I mean, I think my number one thing is actually for the partner to take the maximum amount of paternity or maternity leave allowed. So there's actually been a lot of research done on the impact of a partner taking leave, and that the longer and the more leave that they take, the better the long-term mental health outcomes of the mother. Also, the better chance they have to stay married, actually. So yeah, no, it turns out like that taking leave makes a really big difference. So I think sometimes we just take for granted, right? That, oh, well, dad has to go back to work or partner needs to go back to work. I really encourage people to question that. And these days, I mean, at least for the time being, a lot of companies do provide more than just 2 weeks. So yeah, my number one is get the partner to take leave and as much as possible, because what that means is mom is not alone. Like she physically is not. She's not the only one navigating this. So that's my number one for all families. I think also making sure, and Jeanette touched on some of this, making sure that she knows she has support with the baby, that it is not just her job. So that means, when a partner gets home, immediately taking over care for the baby, just like, okay, I've got him, and what do you need? Do you need me to get out of the house with the baby so you can have peace and quiet? Do you need to take a shower? That's another thing. Make sure she is always able to shower alone. Like it doesn't count if she's got the baby right there make sure she is showering and that she is showering alone. And then two, making sure that what her needs are prioritized. So making sure that she knows she always is going to have time for therapy. I would also strongly encourage that somebody else has the baby during therapy. I've had clients who they are trying, right? They're doing their best, right? But it's like, give them that hour where it's like, no, you are focusing on you and only you, and baby is just cared for. And yeah, that may be tricky with feeding, right? I also say make sure that baby can take a bottle because otherwise, right, that's going to be important so that mom can get a break if she needs to sometimes. So I think really making sure she knows it's not just her job and that her wellness and her needs, before you leave for work, sorry, it's like mostly for partners, but like make her meals and snacks ahead of time, put them in the fridge. Like, if she's sitting nursing, bring her a glass of water. I know it sounds like small things, but all of these are messages that I see you, right? Just like you had said, Jeanette, I see you. You're not alone. I'm here for you. All of those messages are really important. And then, I mean, some of it's so interesting. So many of these things I think can apply regardless of depression, whether depression is going on or not. But, really making sure that you're kind of, especially if she is in the midst of depression, like she's going to struggle to even do the basic necessities, right, of getting through the day and caring for the baby. So that means that everyone else is going to need to step up in terms of the household, in terms of walking the dog, in terms of meal prep. Like these are not normal times. And mom is not going to just be expected to kind of power through. It really needs to be, this is time for her to recover, almost as if she is like convalescing, right? Like things need to change drastically in terms of what she is expected to do so that she can feel that support and feel okay about taking time for herself. So that means the dishes can't be stacking up in the sink and the house can't be a mess, because if that happens, then she's going to be like, oh, look at this. I should be doing this, but I can't, and come down on herself. But if it is cleaned because it's been distributed that he's going to vacuum and this one's going to do, the dishes, and the laundry's going to be folded by grandma, then, the house, it's continuing to go on, and she's allowed to be where she's at.
Yeah, it's a radical way to think about it. I mean, as moms, I think we always think we're giving too, but to be able to receive, to accept, and to have that honored by family members is incredible. So 2 quick comments here in the chat. Susan says, we recently heard about the 3 H's of support. Does the person want to be heard, hugged, or helped? Building on what the 2 of you just talked about, or some combination, but helped should rarely be given without at least one heard and hugged. So I love that. And then Ari says, what can you do for a mom who doesn't want to leave the baby and feels guilt taking any time for their own needs? I've definitely been there for sure. If there's any strategies either of you have for that.
Yeah, I mean, I think this is a tricky one. It's really common. And I think some of that is because guilt is a symptom of depression. So they actually may be feeling more guilty than they ever have in their life. And so this sounds terrible to say, but what I will tell family members to do is to say, almost like, I'm sorry, I don't care. I need you. Again, those I statements, like, I need you to go take this time. I need to know that you're going to be able to focus on this therapy hour without any distractions. I need to know that you're going to be able to have this break, taking a shower on your own, right? And so again, phrasing it as, I hear you, I get it, and yet I need you to push through that discomfort to do this for me. And if it ends up feeling really horrible and you regret it, we could talk about it after the fact, but usually in the end, it ends up feeling, right, taking time for themselves. Like, I mean, it's the silly saying, but like, you can't pour from an empty cup. You just can't. And I think moms, people, there's this phrase like, oh, I'm at the end of my rope. And people keep saying, my gosh, there just keeps being more rope, right? Because I just keep going. I think I'm at the end. Women and moms have this idea that like, oh, I can just keep going. And my gosh, there's a great cost to it. And I think starting from birth, we need to be like, nope. Don't even get close to the end of the rope. You want to be at the top of your rope with lots of extra, right? So we're going to just make decisions based on that, right?
Yeah, I agree so much. I think at your last point, I think that pre-work is so important, especially if they have a history of maybe having something, mental health issue or something like that. Having that setup of like, this is what may happen, and this is what we're not gonna do, and this is what we are gonna do. Like you said, take it, like, it's okay. Like, you're gonna may have this situation, but people really are gonna be there to step in and help and support you. I'll also say, like, there's been moments when I had a client and they didn't want to necessarily leave the baby, but I'd be like, "But I can hold the baby. Use those I statements. I can hold the baby. We can be in the same room if you want, but you need to sit down. You need to rest. You need to go wash your hair. You go do something. I'm in the next room over. I'm in the same space as you." And sometimes just being in the same area is helpful. They're like, okay, was baby still here? I can still keep my eyes on baby, but I'm not holding baby. So that could be a happy medium as well.
And I also want to jump back to something that Jeanette touched on about the importance of sleep. So we know that sleep and like poor sleep is one of the biggest predictors of a mood episode. I mean, it's one of the reasons why I think postpartum depression is a thing too. I mean, I know the hormones and everything, right? But lack of sleep or disrupted sleep radically increases your chances of developing either a depressive episode, or if you have a bipolar disorder, really ups your chances of developing a manic episode. And so I had a client with a bipolar bipolar disorder or diagnosis who knew that about herself. And so she knew, if I am not getting sleep, if I am not getting rest, I don't want to have a mood episode. Like, that would be bad for me, really bad for the baby. And so being able to fast forward to, oh, if I don't take care of myself and my needs, that means bad things for me, which means bad things for baby, right? Sometimes that, if you can get them to look down the road, I think sleep in particular is one that if things start getting iffy with mood, you want to get that back on track as quickly as possible. Again, even with medication interventions if needed, because it's such an important foundation for mental health, right? For us being healthy mentally is sleep. So that is one that really needs to be attended to with a lot of priority.
That's really important. Thank you. Thank you both. On to caregivers now. So Annie, you can take this one first. How can partners and family members maintain their own wellness while caring for a mom experiencing PPD?
Yeah, this is a great question. So, I mean, kind of as I mentioned before, you can't pour from an empty cup. Mom can't pour from an empty cup. Family members can't pour from an empty cup. So, it's really important that caregivers be taking care of themselves. And actually, that is a way to model to mom, like, hey, look, I'm doing it too. Right. So, I think it's really essential to figure out for you what helps you to feel well and to make sure you are taking time for that too, right? So, however, I suggest consulting with mom on when to take care of those needs. So, for instance, I would hate for suddenly, dad is saying, well, it really helps me when I get a good golf game in. I'm just going to call her and let her know I'm not going to be home until 9 o'clock because I'm taking care of my needs. Like, that's not going to go over well. So, however, if you said something like, hey, I've realized I haven't seen my friends for a long time. I think it would be important for me to get out of the house and socialize a little bit. When do you think might be a good time of day or a good time? Can you think about that, right? Because she might have a reaction at first, right? Just think about that. And then let's talk about when I may be able to get that on the schedule. Or, I've noticed I haven't been able to work out very much. I'm pretty sure she's probably not able to either. But if that's really important to your mental health, hey, I've noticed I haven't been able to get to the gym as much. I want to start doing that again. Can we talk about a way that could happen? And by the way, how are you doing with that? Is there anything, right? So that there's this mutual acknowledgement that everybody has needs, and they're all important and they don't just happen. We have to, make time for them or take time for them. The other thing that I think I've mentioned before is kind of using your village, right? If you don't have a village, try to build one up before the baby's born, right? But are there other people who can step in, cooking dinner or taking mom out for a walk or coming, really getting creative around how can we support her, what's going to, be helpful, and making sure it's not all falling on just like one or two people. Because, I think if you're sacrificing yourself, it's only going to lead to resentment at some point. And so we want to make sure we're not doing that. And then I have one quote that I'm going to share. I think it's from Al-Anon, and it's not your rock. And I think Jeanette mentioned this before too around the fixing. Like, it is not the family member's job to fix the depression. The depression is the mom's rock. It's hers that she has to pick up and carry. And so don't try to carry it for her, right? We want to, right? Hand it back to her. If she'll take it, great. If not, set it gently at her feet and say, hey, there's a rock there. I hope you do the things you need to not trip over it, right? But just recognizing it's not ours to fix. And we can be there to support and encourage, but ultimately it's out of our hands.
That's great, Annie. Thank you for sharing that. I wholeheartedly agree. I think I see, like doulas in general, we probably see caregiver burnout show up just as much as other perinatal mental health concerns, just for that very reason that they're trying to hold the rock. They're trying to be the strong one, holding everything together. When in actuality, that they're not meant to do that. Um, so I agree with having a support network, like you mentioned, and also that idea of what you were saying, sharing the load with other people, whether that be friends, family members, or someone else in your network that you could sort of pass things off to that you trust to do a specific task. In terms of breaks, I know you mentioned, asking mom. I love that, asking mom first if you have something that you're going to do to go out. But if you need a smaller break, I was going to say a smaller break is also could be a thing. So maybe you do 10 minutes alone, 20 minutes alone, go for a walk, grab a morning coffee, or just sit in silence for a little bit. That can really help and reset your nervous system a little bit. And just gives you a little space and breathing room that can really mean a world of difference for you as a caregiver. And going back to modeling, like one thing that we talk a lot about in like my doula sphere is how important it is to check in with ourselves. And I tell that to my caregivers and families a lot, because you need to be able to check in so that you're showing up emotionally grounded for the mom and for your family, right? And so that means being honest, making space for those hard feelings, and sometimes stepping back and being like, I need someone else to fill in for a little bit, or I need help myself. And you asking for help is strong too, right? Saying that I may need a therapist, or I may need a new parent support group. And of course, that time hopefully should fit within when mom gives you the space to do that. But it's okay to have that group or have that person or have that space to go to. Um, just for a practical example, I had a dad more recently that took that advice to heart, and he started meeting up weekly with another new dad that he met at work. And they just had either a walk or went for coffee one day out of the week for a couple hours. And he told me that moments reminded him that he wasn't alone in this process, and he could bounce off like what's going on with baby, what's going on with his life and things like that. And when he got home, he was more calm, he was more patient, he was able to support his partner through the things that she was going through better. So take care of yourself, check in with yourself, and do what you need to do. And I feel like when you support yourself, the whole family benefits, right? Mom gets support, other kids get support. So yeah, take the time within reason.
Yeah, it's crazy to think that like we'd have a kid and like everyone knows what to do. I mean, it's an insane premise to begin with. So yes, get support, ask for help. Our last question, and I'm going to double back at the very end to a piece that I forgot to ask, but uh, adding on to just a caregiver, obviously now there's at least one child, maybe more, they're present as well. So, how do you recommend families balance caring for other children while managing family responsibilities and then ensuring that the mom is getting the adequate support that she needs? And Jeanette, you can take that one.
Yeah, I just want to start by saying this is such a real and common concerns. Families are often doing their best to hold everything together. You have other kids, you have meals to plan, school drop-offs, recitals, concerts if you're still doing it, appointments. So all of this while trying to support someone who's struggling and maybe feeling overwhelmed, and that can cause the caregiver to be overwhelmed as well. So one thing I always recommend is or remind families first and foremost is you're not supposed to do this alone, as we mentioned. So I often ask, like, who's in your circle? Are there friends, relatives, or members of your community or faith community that can step in on your behalf for practical things like childcare, cooking, transportation? And one thing you can do is actually make a list of all the things that you would like help with, and sort of start filling in the holes of like, which person in my life could do this? Is it like my neighbor from across the street, or is it my friend from down the road? Or, what I'm saying? Like, you could fill people in to really take over those things. One other thing I encourage families to think about is tag team caregiving. So this might look like a partner or a grandparent focusing on the other kids for a bit, while someone else, maybe like a doula or like a postpartum visitor, spends time with the mom, checking in, helping with baby care, and giving the mom a chance to rest. Um, And another thing is, let's not forget that support can be simple. So, like we've been saying, like holding the baby while mom has a shower, bringing over a meal, asking how she's doing, checking in on her, that's all support. And that can really go a long way with mom. Um, Another thing I would say is if a birthing parent is already connected to a mental health professional, caregivers can actually help make sure that these appointments are prioritized. So even if that means rearranging schedules to make sure that mom can make that appointment, that means a world of difference. And if they're not already connected to a mental health professional, the caregiver can help find those resources and find the time that fits within the multiple, different avenues you may be pulled with other kids. Um, Another thing, and it depends on the family if they're open to it, but I do encourage talking to the older kids about what's going on if they're old enough to understand, and always doing it in a way that they can understand it. And so that may look like the caregiver or partner explaining that mom is having a hard time right now. She's getting the support that she needs, and reminding them that what you see or what may be happening is not their fault, is no one's fault, and that we're all working through this together. So really taking a team approach.
I'm going to add on to the what to talk with the kids about, which not only is it not their fault, but it is not their responsibility to make her feel better or cheer her up or like be extra good. And also really normalizing this happens to a lot of women after they give birth. It's, kind of part of the process, and it can be really hard, but, we know what to do just so that they know, like, I mean, sometimes I almost wish that people like knew. I mean, first of all, having a hard time after a baby is born, like, isn't that everyone, right? Like we should somewhat like almost like shift, like if it doesn't happen, great, but like we should all be ready, and maybe even ahead of time. Sometimes moms after they deliver, can have a period where they're feeling really down, or just it can be really rough, and we don't know if that's going to happen to mom, but if so, it's okay. We'll get her the help she needs, and it's not anything for you to have to worry about. I also think sometimes it's helpful to check in with mom about what she once. And sometimes I've heard moms be like, sometimes I want to break from the baby and I want to be able to go hang out with my other kids who I haven't been able to see in a while. So if she'd like to like watch cartoons with some of the kids, and have somebody else take care of the baby, where she wants to drive so-and-so to soccer practice because that's what she used to do and she hasn't been able to do that. Like really giving mom flexibility if she can. Again, this is where like the ability to take food from a bottle can be helpful, can really allow her to be like, oh, I haven't lost this whole life that I used to have. I can still find ways to do the things that used to bring me joy, or to, so really giving her some agency over what her role is, and not just assuming it has to be with the baby all the time. And I think also too, allowing the kids to participate in some of the help, again, depending on how old they are. But, really being like, hey, this is a time as a family, like, let's step up. If we were working on a farm, right, we'd have to shift around, like who's going to milk the cows and who, so like, let's talk about all the things that mom usually does. And like, okay, who wants what, right? Oh, I mean, I'm sure they're all going to be like, we don't want any of it, right? But it's like, no, this is what we're going to be doing, right? So who wants to unload the dishwasher? And like, I mean, kids, like even young ones can help in some ways, right? And that's really good, like teaching for them too. I also wanted to say, when Jeanette was talking about using, you're not supposed to do this alone. And, oh, we can have people bring meals and we can have them drive. If the mom is like, oh, but I don't want to burden people, everybody's so busy. One of the things I like to remind people is think about a time when you have been allowed to help someone else out. Did you feel burdened? Usually it is such a gift to get to like cook somebody a meal and bring it to them when their family's in need, or to be like, I got you. I'll pick up the kids for like you. Like if it does something to humanity, like there's this swelling of your heart, right? Like it is truly a gift to be allowed to help someone else. And if they can remind themselves of how it's felt when they've been able to do that for people, sometimes it's like, give your loved ones gifts by letting them help you in some kind of way. You are giving them a gift by having them sign up on the sheet. Like, they want nothing more than to get to do that. And sometimes that can shake them a little bit and be like, okay, right? Because you all were nodding, right? You know what that feeling's like. It's beautiful. It's one of the most beautiful things that we can do as humans, is to show up for each other. So that, I think, can help get families like, oh, okay, we can maybe let people help.
Oh, that's so great. Wish you two had been around 27 years ago when I had my kid. So the last little bit of a question I didn't get to that I'll ask now, and then you guys can kind of use it to close out if you have anything you want to say to close out as well, is just helping mothers build confidence to reach out for help. So, if we're a caregiver and it's not our rock and it's not for us to fix, how can we help to build confidence so that people can reach out for help? And you guys can both answer. Jeanette, you can go first. And then if you have anything in closing you'd like to say as well.
Yeah, so personally, I believe the first task should be to normalize seeking out and accepting help, just as we've been harping on for the past hour. I say to parents, like, asking for help is one of the strongest things that you can do for yourself, for your baby, and for the family. And so I really like to frame asking for help as a strength and not a weakness. And then once mom hopefully understands and gets on board with it, that's when I like to say, like, offer her concrete support. And so from my perspective, it's usually, I will say, like, would it help if I sat with you while we called your provider, or maybe the baby's pediatrician, or your therapist, or finding a therapist? And then I even offer to dial the number, or even write the message up. Like, she may say it to me verbally and I write it for her so that she has the right words to say, or the words that she wants to say when she goes to the appointment. And so I feel like those sort of shared moments of action can really help reduce fear and shame, and help them all feel like they're not alone in navigating this next step. And then another thing I love to do and encourage for the caregiver to do is to celebrate the small wins. So whenever mom makes her first appointment, whenever she goes to it, tells you a bit about it, or maybe even writes it in her calendar, I'd say, I'm so proud of you for doing that. This is awesome. This is a great first step. You go, girl. Like, they celebrate those small wins, and it means such a big difference. And she feels warm knowing that you're by her side through the process and helping her through it.
Yeah, and I think the only thing I would add is, just starting with what she thinks would help. Because, saying, what do you think would help? Right. And sometimes they will say, I have no idea, or nothing's wrong, or everything, depending on how negative they're feeling about it, that they might not be able to generate anything. But I think then you can say, well, I have some ideas, and would it be helpful, is now an okay time for me to talk about some of the things I've been thinking about that might be helpful for us as a family, right? And then the other thing I would say too is making sure that they know, like, you can trial it, you can, like, give it a try, right? With some of the programs, like a partial hospitalization program, I'm always like, go tour it. Like, they will let you go tour so you can see what it looks like. You can meet some people, or, like, just give it a day or two, and you can always quit, right? Like, let's just try it. Same with a therapist. If the first one you don't connect with, like, it's okay. Match is important. It can take a little while. Like, let's just try it and then come back to it and see what you think, right? So that they know there's an option, right? To give things a try, and then not, and that you're committed to listening to what they think about it and trying different things.
That's great. Well, thank you guys so much. Our last comment here, Courtney says she loves the "I'm so proud of you." And I think that's just so important. This is a normal part of being a person in the world. And I'm really grateful to you, Annie and Jeanette, for sharing your stories and your professional expertise and your thoughts around how we can support everyone when it comes to PPD. Thank you so much. And thank you to everyone who watched us live or will watch this recording. We hope this information empowers you, your loved ones, and your family. If you would like to keep learning with us, please go to our website for Families for Depression Awareness, familyaware.org, and sign up for our newsletter. You can follow the QR code here to fill out our survey. Your feedback's really important to us. We would love to hear from you. So if you can take a few moments to do that, we'd greatly appreciate it. From all of us at Families for Depression Awareness, thank you and good evening.